what has been Singapore's response to the pandemic?
For inviting me to this panel. I'm really honored to be here. I think that the responses are not dissimilar to what we are doing. Dr. Fazila was describing is being done in Malaysia. In Singapore, I think we are neighboring countries, and certainly we coordinate extensively in terms of how we manage the pandemic. I suppose to just look at some differences. I think one of the things that we did was very early on was to implement a trace and track mechanism. So we have, to that end, we have implemented a trace together kind of token. So it comes in two forms. So one is a physical device that you could carry with you, and the other is an app that you can put in your phone. So these devices have the ability to track only the people who are in the vicinity of the user, not the actual GPS locations of the user itself. So I think from the privacy concern area, so that's something that has been continuously reinforced in the last couple of months. And just last week, we had unfortunately a second sort of wave of small clusters coming out throughout the country. And we think that it's most likely to be a sort of imported type of case that for some reason has went into the community. But using this trace together type of technology, we are able to very quickly contain these clusters, swab everybody, and contain the second and third generation spread of the virus to the community. So I think one of the key things that we have done in the last year that really helped with the control of the pandemic is to be able to implement these tracing and controlling type measures to prevent community spread. I think it'd be worth talking a little bit about vaccination as well. So currently we have in Singapore about 70% of the elderly population that is above 60 years old being vaccinated. We are going to the next phase where we'll be vaccinating the 45 to the 60-year-olds, and slowly we'll be propagating to those who are of lower risk. Of course, all the high risk type of professions, i.e. the healthcare workers, the airport workers, we're looking at about a 96% vaccination rate. And I think that's the other part of the strategy, which is to ensure that the people at risk get vaccinated first, so as to reduce the potential of complications in this group of essential workers. So I think that the third area to kind of mention is the balance between opening up and really reviving economic activity versus the measures that we are taking. I'm sure we'll talk a bit more about this later, but one of the key lessons learned is we should open up progressively and not suddenly, because that would result in increased risk of community spread and uncontrolled transmissions. Thank you.
Thank you so much. Shane, could you share a little bit about what's been going on in New Zealand?
Yes, kia ora, and thank you very much for the opportunity to be here today. Nice to meet everybody. Yes, look, we had an elimination strategy, which was basically to keep it out, find it, and stamp it out. That was the original elimination strategy for us. We're an island nation, so we fortunately have great control of our border, and part of our strategy was controlling entry to our border. So our borders were shut down fairly quickly. At one stage, obviously, it was very difficult for people to get here anyway because of disruptions, I guess, to flights around the world and stuff like that. Surveillance, we did a lot of testing of the population just to see if we could identify, as in find it. Obviously, public health measures in terms of physical distancing and so forth were really important. Contact tracing, for us is and previously quite a manual process. So